Okay. 3, 2, 1.
All right, so I have my MAR for my patient. I'm going to be giving my patient 4 medications today. I have regular insulin, NPH insulin, and Ansef and heparin. I have a blood glucose of 136, and my patient has no known allergies.
You only have to label the insulin.
Okay. So because my patient has no allergies, I'm going to go ahead and hold the regular insulin because, because my patient's blood glucose level is 136, I'm going to go ahead and hold my insulin because it's less than 150, and that's 0 units for the regular insulin. For my Ansef, I have 500 milligrams, and I'm going to reconstitute that to 500 milligrams per milliliter. So that means I'll give my patient 1 milliliter of Ansef and heparin. I'm going to go ahead and see what we have in the medication bin. Okay. All right. So I'm going to go ahead and get some alcohol pads here, some gauze. I am going to get my NPH insulin. Okay, I'm going to go ahead and get I'm holding the regular insulin, so I'm not going to get that. I'm going to get Ansef, which is pre-constituted 500 milligrams per milliliter. So that means I'm going to give my patient 1 ml of Ansef. And my heparin is 10,000 units per ml. Okay, so that means I'm going to give my patient 5,000 units. So that's half an ml. Okay? All right. I'm going to need a insulin syringe, 50 units for the 35 unit NPH. And that already has a needle on it for me. The Ansef is going to be the Z-Track. I need 1 ml. I'm going to go ahead and get a 1 to 3 ml syringe for that with 25 gauge needle, 1 inch because my patient is a normal sized patient and I don't need a 1.5. Okay. For my heparin, I'm going to do a half an ml, so I have 1 ml syringe here. Heparin is sub-Q, so I'm going to need a 5/8 syringe, 25 gauge 5/8 syringe. All right. Okay. So I have all of my medications ready to go. I'm going to go ahead and clean the top of my NPH insulin. One, 230. Okay. And roll it so it's all good and mixed up. Take my 50 unit syringe. Oh, first I'm going to perform my hand hygiene because I came from the medications drawer before I open my sterile syringe. Okay. Okay, so I have a 50 unit syringe for my 35 units of insulin. I'm going to go ahead and get 35 units of air and put that into my NPH. Okay, so inside my NPH, and I'm going to pull out 35 units. Okay, so I'm going to give this to my nurse to verify.
Looks like 35 units of NPH insulin.
Thank you. Okay, and provide safety so that I don't hurt myself there. Okay, next I'm going to go ahead and label my insulin syringe as INS, just so I can know that that's the insulin syringe. Okay, next I am going to prepare my ANSEF. I'm going to go ahead and clean the top of the ANSEF. 1, 2, 30. And then my ANSEF is going to go in a 3 ml syringe because I need 1 ml of the medication. Okay. And I'm going to use my 25 gauge 1-inch syringe because it's an IM medication injection. Okay. All right. So I'm going to go ahead and pull out or put in 1 ml of air into my ANSEF. Okay. And I've already cleaned the top of my bottle, so I'm going to go ahead and inject that 1 ml of air into my ANSEF and pull out the medication. And I'm going to get rid of my air bubbles.
Hello, my name is Crystal Silverman. I'm recording for my hair
Okay, so I have 1 ml of ANSEF. And I'm going to go ahead and scoop to recap my needle. Okay, and I'm going to label this syringe an A for ANSEF.
Give me a thumbs up when you're recording.
I can't give you a thumbs up when I'm holding this.
Give me a pinky up.
Oh, okay.
Okay.
Wait a minute. I didn't get ready yet.
Okay, next I'm going to go ahead and pull out my heparin, which is also a high-risk medication like insulin. So I'm going to have my nurse verify it after I pull that out. So I have 10,000 units per ml. I have 10,000 units per ml. And I'm going to go ahead and give my patient 5,000 units. So that's going to be a half an ml. Okay, first I'm going to go ahead and clean off the top of my heparin. 1, 2, 30. Alright, and I'm going to pull out my 1 ml syringe. And because this is a sub-Q injection, I'm going to go ahead and give my patient a 5/8 needle, 25 gauge. Okay, so I need a half an ml. I'm going to inject a half an ml of air into the vial.
A total of 39 units of insulin. I'm going to go ahead and use a 100-unit syringe.
And then I'm going to pull out my 5.5 ml of medication.
100-unit syringe for that. For my ANSEF, because it's an intravascular and it is 250 milligrams, so I am going to find my ANSEF. ANSEF 250 milligrams is 1 milliliter, so I am going to use a 3.
And I got a pretty big bubble in there, so I'm going to try to
22 gauge
get rid of that.
needle with a 1.5 inch length.
Beautiful. Okay.
With a
And I'm going to give this to my nurse to verify what she sees because it's a high-risk medication.
That looks like half an ml of heparin.
Okay.
I am going to go ahead
And
and
it's 10,000 units per ml.
milliliter syringe for PPD.
Okay, and I'm going to go ahead and recap with the swooping
I'm
method.
going to get a different one. This one I think has been used.
Okay.
I have
Okay, so I have prepared all my medications. Now I'm going to go ahead and go into my patient's room and give my medication.
I'm going to pull my insulin right now.
All right. Knock, knock, knock. Hi, how are you doing today?
Good, thanks.
That's good. I'm here. My name is Beth, and I'm a student nurse. I'm here to give you some medications today.
Okay.
Can you verify your name and date of birth for me, please?
David Schumer, 11063.
Thank you. And I'm going to go ahead and grab your wrist, and if that's all right with you, to verify your name on your bracelet, okay?
Okay.
30 seconds, hand hygiene.
Plenty of alcohol wipes.
And it does appear that you say who you are. You are who you say you are. Okay.
I'm going to go ahead and
Today you're going to be getting insulin, Ansef, and heparin, okay?
Okay.
Okay.
we are going to go ahead and go to the table to draw a cup.
Your
My patient.
insulin is going to be a sub-Q in your stomach. Ansef is going to be intramuscular in your arm. And heparin is also going to be on the other side of your stomach, okay? Okay. And your insulin injection is going to be to lower your blood glucose. We're only giving one of them because your blood glucose is close to normal range, okay?
Okay.
Ansef is going to be an antibiotic, and that's going to help you get better. And heparin is a blood thinner, okay?
Okay.
Alrighty. Did you have any questions before I start?
No.
All right. Which side did you get your insulin injection in last?
My insulin, the back of my arm.
Okay, so is it okay if I do it in your stomach
Yes.
this time? All right. And do you have any allergies to any medications?
No.
Perfect. All right. So I'm going to go ahead and start with your insulin injection, okay? Here's your stomach.
Thank you.
Thank you. And I'm going to go get some blood. All right. Knock, knock, knock.
Yes.
Okay. I'm going to go ahead and can you verify your name and date of birth for me one more time, please?
David Schumer, 11063.
Okay. All right. And can I see your wrist again, please? Thank you. Perfect. Thanks so much. And I'm going to give you your insulin first. Okay. All right. Are you all ready?
Yes.
Can you go ahead and lift your shirt for me, please? Thank you. Okay. And first is the insulin, 35 units of NPH insulin, all right?
Okay.
Okay. I'm going to go ahead and be a slight pinch, all right?
Okay.
Okay.
4 units of regular insulin.
All right. Safety.
I'm going to second nurse. Second nurse, can you write me?
All right. How are you doing?
Good.
Good. Okay. And that is your right side. Is that correct?
Yes.
Next, I'm going to go ahead and give you your antibiotic, and that's going to be in your deltoid, or sorry, no, in your gastrogluteal area. And if you could go ahead and turn just a little bit for me here. I'm going to go ahead and point out where that is on my patient. Okay, so I'm going to put my heel of my palm on her greater trochanter.
Can you please identify what I have in my syringe?
Heel of my, because this is your left side, my left palm on your greater trochanter, my thumb towards your pubic region, my pointer finger towards your midline umbilicus, and my rest of my middle finger pointed towards your posterior region. Okay, so this is where I'm going to give you your injection. Okay, so I'm going to go ahead and mark that with my my alcohol pad so that I don't lose the spot while you get comfortable again. Okay?
Oh.
And I'm going to go ahead and do my ventral gluteal right here on my patient. Don't worry about it. And this is my, again, my region pointed towards her groin, umbilical region, and posterior, okay? So there, I'm marking my area, and I'm going to give the injection right there. Okay, from the inside out, 2 inches. Okay. And this is again my IM injection for ANSEF for my patient's antibiotic. And this is a Z-Track injection. But I need to clean it after I do the Z-Track. Okay, so first I'm going to Z-Track swipe, then clean, and then uncap my injection, do my patient, injecting the medication, remove the needle, and then let go of the muscle and safety. All right, a little bit of gauze just to make sure there's no leakage on my patient. Beautiful. And then my last injection is going to be of heparin. Okay, and my heparin is going to go sub-Q on my patient's other side of her abdomen area. Okay, so there's your stomach again. So that's going to be 2 inches away from the umbilicus. Again, right here, I'm going to go ahead and give you your injection for heparin, okay?
Okay.
Alrighty. I'm going to go ahead and clean the area. Uncap my needle. Okay. Are you ready?
Yeah.
Slight pinch, all right?
Okay.
Okay. Again, pinch. Inject my heparin. And pull out my patients. And clean it just with a gauze. Alrighty. Okay, that's it for your injections for today. Is there anything that you need right now? No. All right. So I'm going to go ahead and put your bed back to lower position. And here's your call light.
Thank you.
Okay. And I'm going to go ahead and leave the room with my patient's stuff, needles. Okay. And the needles into the sharps container. Oops, gauze was flying in there. All right, and there's my trash can for my other information. Lastly, I'm going to go ahead and document my patient's injection sites. Oops, that was actually, that was right. That was right. Patient's right ventral gluteal area. Let's see here. So we have little codes up here for right abdomen. So that's going to be a 1. We held the insulin, regular insulin. The ANSEF was injected into the right ventral gluteal, which is a 9. And that was given. And then the heparin was injected into the left abdomen, which is a 2. Alrighty. You're good.
Touch things. I'm going to wash my hands. I know I'm going to go into my patient's room.
All right. Thank you.